Behind every injection, there is always a nurse. What comes in your mind when the doctor sends you for an injection? Pain. Pain is inevitable. Right in front of your camera is what a student nurse uses to learn how to inject a patient. There is a dry and a wet spirited swab, a felt pen to mark the injection site. Then there's inside this envelope, there's a syringe and a needle that I bought. For the needle and the syringe, you have to check the expiry date because you cannot inject a patient with expired items. That is below standard. Okay, so you confirm that the syringe and the needle are not expired. Then we have the orange. Imagine student nurses uses an orange to train and learn how to inject a patient. We also have spirit, and this is surgical spirit. A tutor must supervise and ensure that the student have learned how to inject a patient before approving. So there's a way that a syringe is opened. You hold an edge of a paper, one edge and the other, then you peel, and inside there is a syringe. You peel it, as you can see. Then the same applies to the needle. You do not tear the paper, you don't tear through, you always hold a paper at the edge and the other edge, then you peel. Then you attach them together. After attaching together, you place the needle and the syringe on top of a kidney dish. They learn how to create rapport with the patient, how to explain the procedure to the patient, and how to prepare a drug for the patient. Here, the orange is assumed to be the injection site of a patient. A felt pen is never used on a patient, but here the teacher uses it to show how to partition the injection site of a patient. As the student follow closely, the teacher takes the felt pen and the orange and starts drawing, partitioning, divides the part into 4 parts. That is a vertical line dividing the injection site into the outer and the inner quadrant. That's the outer part, and the other side is the inner side. Then she later divides the site into a horizontal line. It divides the site into the upper and the lower side. So a vertical and a horizontal line. And the best site to inject is, it is the upper outer quadrant. There in specific. Upper outer quadrant, lower outer quadrant, lower inner quadrant, and the upper inner quadrant. Those are the 4 sites whereby you draw an imaginary line using your cotton wool, and then you go ahead and inject the upper outer quadrant. So let's inject the patient. We are assuming that we've already prepared the drug and assuming it's at that level. So you pick the wet swab, that's the spirited swab. Then you draw an imaginary line, a vertical line and a horizontal line. Then on the upper outer quadrant, you clean the area to prevent the introduction of microorganisms into the site. Then you pull out the needle, press the injection site, then you inject, pull to see whether there is blood coming out. That's a bad sign if there is blood coming out. Then you push the drug, and then you take the dry swab, put against the place, you pull out the needle, drop it inside the safety box or the sharps container. Why do you think we inject on the upper outer quadrant? This is to prevent the injury of the nerves. On the deltoid muscle, you get the axillary nerve there, and on the gluteal or the buttocks, there is a nerve called the sciatic nerve. Then on the thighs, there is a nerve called the femoral nerve. Our site is not bleeding because we pressed the muscles together before injecting. Once you're done, you thank the client and you clear the area. Subscribe to my channel for more videos like this. Nurses, do not attempt to recap the needle. You might prick yourself when you try to recap. Press the subscribe button to subscribe to my channel. Put on the notification to be notified immediately I post a video. Nurses, do not drop the needle inside a dustbin. Instead, place it on the sharps container.